Welcome back. We have Misa Manshadi joining us from Manshadi Pharmacy. It is great to have you back on the show, Misa.
Thank you for having me, Susan,
yes,
again.
It's great to have you. We're talking today about how valuable our pharmacists are and making sure that you as the viewer know just how many things they can do for you and answer questions for you. As you know, and as many of us are aware, we have a pretty serious doctor shortage in this province, in Kamloops as well. Numbers somewhere between 15,000 and 30,000 Kamloops residents without a GP, very high numbers. So we're spending our segment today talking about making sure that people use their pharmacist to the best of their ability.
Yes. Well, this month is a pharmacist awareness month of March. A lot of people need to recognize that, pharmacists, they don't do the dispensing anymore. They don't do the counting the pills and putting it in the bottle. That's done by the technician. What their job is to find errors, side effects, drug interactions, medication reviews, and doing vaccinations, many things. So what we need to do is recognize that pharmacists now are the most accessible healthcare professional. That means you can just walk to a pharmacy and ask for a pharmacist and say, I have this concern, this question, what can I do? So I like to promote that in our city, that, if you have a problem, if you have a concern, please don't hesitate and go see your pharmacist.
And you were saying that the walk-in clinic located near your pharmacy is usually fully booked for the day by 9:30 in the morning.
That's right.
We've all experienced this. I'm lucky enough to have a GP. I've gone to a walk-in just because it was closer and what I thought would be more convenient. But when they're booked up by 9:30 in the morning, that's not helping anybody.
So this is it. Even though you have a GP, that doesn't mean that if you want to see your GP today or tomorrow or 3 days from now, you can see them, because they are so booked up and they are so busy. So we see a crowd of people coming to the pharmacy and asking different medical questions, and we try to help them as the best ability that we have.
Tell me what you guys take in university so people understand where your training is.
Certainly. I graduated from the University of Saskatchewan, and I had to take 2 years of pre-pharmacy. And after you take in 2 years, and there's a certain science courses that you need to take. After 2 years, you apply to the College of Pharmacy, and if your marks are good enough, then you will get to the College of Pharmacy, and then you do another 4 years. So minimum for me from the University of Saskatchewan was 6 years. That means for 6 years, actually for 4 years of those 6 years, you study drugs. You study the therapeutic uses of drugs, and you become an expert in drugs. So if you have a question regarding drugs, please don't hesitate and go see your pharmacist about the cost. Should I be on these drugs? And the pharmacist can recommend it to you, what you can do, and then you can discuss it with your doctor and then make a decision to what you would like to do.
How often do you see somebody that is on a series of drugs that perhaps are counterproductive to one another? I'd like to think that we have a universal computer system now that you as a pharmacist can go in and see and make sure that these drugs are not combining in the wrong way for the same individual. But do you often see people on things that they shouldn't be at the same time? Well,
we usually stop a certain prescription, 1 or 2 a day, that it should definitely not to be taken.
So it still happens?
It still happens, and we will look for it, because we are the last person before the product goes out. So you always have to be alert that things doesn't go wrong in the pharmacy. So it does happen, and we are there to catch it, and we do catch it definitely 1 or 2 a day.
And another reminder for some people that may not know, but pharmacists also can give shots, like travel shots. I know I had my kids immunized for a trip abroad at my pharmacy.
That's right, you can do that. But one of the most important thing that many people, they still may not know, is called patient review. and medication and patient review. And that what it means is you go see your pharmacist, and if you're taking 4 or 5 medication, the government actually pay to the pharmacist to review those medications, see if it is good for you, is it appropriate for you, and so forth. And they usually take between 15 minutes to 30 minutes of your time, and they will go through all the medication and making sure it's appropriate for you. So please, if you are taking 4 or 5 medications, go see your pharmacist and do patient and medication review and make sure that those drugs are appropriate for you.
Okay. Misa, you seem like a pretty smart guy to me. I come to you. I trust you.
I thank you so much. Thank you so much for your generosity, for inviting me to come here.
You're very welcome. We enjoy having you on, so thank you for being here.
Yes.
We are out of time. If you have questions for Manshadi's pharmacy, you can certainly contact him at the numbers on the screen. There's a South Shore and a North Shore location. I know both have been up on the screen. We are giving away Mariana's Trench tickets when we come back. Stay with us.